Tonight on KGW News, tracking counties for COVID cases, where cases have quadrupled just this past week. And later,
we don't know what's going to come next. What is the plan?
Teachers make a plea for a better strategy as more schools head to remote learning. But first, concerning policies for nurses. Some hospitals now allowing more of them back to the workplace despite testing positive for COVID. Your news starts now.
Good evening on this Tuesday evening. We start tonight with hospitals letting employees who are getting over COVID stay on the job. Those hospitals are dealing with severe staffing issues, including many in Portland. But for some employees, it's difficult news to hear and something they believe patients should know about. Catherine Cook reports.
Spring 2020. It's been almost 2 years since people supported healthcare workers like this. Support many providers feel devoid of now. One Legacy Health nurse who asked to remain anonymous told KGW, "We feel forgotten, devalued, and taken advantage of. We are exhausted, working in unsafe conditions, short-staffed, and with very low morale." Those feelings, the nurse tells us, are exaggerated by this new COVID guidance policy. Legacy Health sent it to employees on Friday. It says employees who test positive for COVID can now come back to work 5 days after the start of their symptoms if those symptoms are mild enough to be controlled by over-the-counter medication. In short, employees who have COVID and are still symptomatic can now treat patients. With staffing shortages, Legacy Health officials say it's a no-win situation that led them to a tough decision.
We put our staff safety on par with our patient safety.
Legacy Senior VP and Chief Medical Officer Dr. Seth Podolsky.
We are increasing risk tolerance to be able to care for the folks that so desperately need it. If we don't do that, we're going to find ourselves in crisis standards of care much faster as a region.
As it stands, many healthcare systems are working under contingency standards, which under CDC guidelines allows healthcare workers with COVID who don't have symptoms to return to work after 7 days with a negative test, or fewer days without a test if there are staffing shortages, something the public may not be aware of.
Suggesting that healthcare providers may indeed be symptomatic after having tested for COVID. How do you plan to disclose that to patients?
So we don't have any current plans to disclose. That could change. I don't know of other health systems in our region, Catherine, or the country that are doing that. Again, because what we know about the highly transmissible nature of Omicron.
Legacy and hospitals nationwide are facing a workforce slashed by illness and understaffing. At the same time, they're treating more people. In California, state health officials just announced hospital staff who test positive but don't have symptoms can also continue working. Rhode Island and Arizona have similar guidelines, and the list is growing.
Nurses are very concerned.
Kevin Mealy is with the Oregon Nurses Association, a union that represents many nurses in Oregon, although not those at Legacy. He says their concerns extend well beyond Legacy's policy. He points to the CDC's 5-day return to work without a test guideline. Those changes followed studies that show while Omicron may spread more quickly than other variants, it may also produce milder symptoms. However, the CDC also notes that even after 5 days, around 30% of people remain infectious.
And so when you take a nurse or frontline provider from being part of the solution as a caregiver and turn them into part of the problem as someone who now has COVID, you've really exponentially worsened the overall problem.
They're short-staffed and they're so overloaded by patients. Do you think those are reasons to continue with this line of thinking?
So there are more steps to limit the exposure of the healthcare workforce and prevent them from getting sick to start with before demanding that they work sick.
Neely says those steps should include improving internal testing and exposure notifications, limiting hospital visitors, and requiring N95 masks or equivalent across the board.
Hospitals are the place we go to get care and to get well. We don't want it to be a place that continues the spread of COVID-19.
Catherine Cook, KGW News.
This comes as COVID test positivity rates have quadrupled in some counties in the last week. And health experts say that shows just how fast Omicron is spreading in the community. We chatted with Clackamas County Public Health Officer Dr. Sarah Present. In Clackamas County, the test positivity rate for the first week of January was almost 23%. It was just under 5% a month ago. But experts believe far more people have COVID than those test rates show, since many people are doing at-home tests. Those results are often not reported to officials.
So we know, first of all, that our case rate is an undercount. And we know that there are lots of cases that are probably not being tested at all because our test positivity rate is so high. So the test positivity rate has a lot to do with the test availability for those people who are sick. So looking at both of those numbers together, I know that there's a lot of COVID in our community that we're not knowing about.
And a lot of people are wondering when to test for the Omicron variant. Dr. Present recommends testing 3 to 5 days after exposure, or day 2 or 3 after symptoms start, so your viral load is high enough to produce an accurate result. If your results are negative, do another test in 24 hours to confirm. We are also following the ongoing impact of the pandemic on our schools. We learned tonight Jefferson High School in North Portland has become the latest school to go into distance learning. This comes after the Salem-Keizer District announced all schools will be closed Friday due to COVID staffing issues. That's in addition to other Portland area schools also going remote. Pat Doris has the latest.
In the Tigard-Tualatin School District, 6,500 students are going back to distance learning. The district will temporarily close Tigard High School, Tualatin High School, along with Fowler Middle School and Hazelbrook and Tualatin Middle Schools. They join Durham Elementary, which was already closed because of COVID. Superintendent Sue Reekie-Smith told me there simply were not enough people to fill all the positions needed to keep the schools running.
Because this thing is incredibly fluid, and much different than Delta. Delta was a slower roll, and we could keep an eye to it. This one is just literally moment by moment.
She said the daily battle to find enough healthy people to staff the schools is exhausting.
Our day starts here at about 4:30 in the morning. We take a look at staff outages and sub-requests. We then take a look at where we are with our students. I get another report around 8 a.m., one midday, one in the afternoon, and then in the evening, we're taking a look at sub-requests for the next day. And 4:30, we start all over again.
She hopes the switch to online is brief, and as of right now, the plan is to return to in-person learning on Monday, January 24th. In the Hillsborough District, 2 large elementary schools, Indian Hills and Brookwood, will both go online, sending 779 students back home. A spokeswoman said the concern is a possibility of a high number of people infected who are now at school.
It's a number of factors. It's, can you field enough staff to hold school safely? Have there been enough potential exposures that the resources it would take to potentially put all of those people through a testing regimen to determine whether or not it's safe to hold school or not is realistic.
Forest Grove High School is also moving to online classes, with a third of their students already absent. At the Salem-Keizer District, the second biggest in Oregon, it's day-to-day, says the assistant superintendent.
We don't actually have a threshold because every site is different. Of course, that 20% would make things really difficult to keep buildings open and functioning the way we'd like to.
Late today, the district announced it will close all schools Friday because of a growing shortage of staff and higher than normal student absences, all apparently brought on by the coronavirus. Pat Doris, KGW News.
As of right now, a handful of Portland public schools have transitioned to remote learning, including one of the most recent, Fabian, a pre-K through 8 school. It's frustrating for everyone involved, and teachers and parents do have questions. One, we've been hearing a lot: what is the threshold for moving a school to distance learning? Are there specific metrics?
I hear our families and I hear our educators wanting a clear metric or a clear threshold. But it's not. I don't think that's. It's not that simple. Knowing, again, our premise is to keep schools open.
Jonathan Garcia, who you just heard from there, says PPS is monitoring multiple data points, including absences and staff vacancies, among other things. Here is some of the raw data. Today, he says the district had 391 teachers requesting a substitute. 160 were not filled. And on Monday, almost 1 in 4 students district-wide did not show up to class. Earlier today, he said there were a few schools being monitored closely, but he wouldn't say which schools because the information could change quickly. In Washington, Governor Jay Inslee is calling for action in Olympia and laid out his priorities in his State of the State address today. Top items include school funding to keep kids in class, more to help people who are homeless, such as building affordable housing, and action on the environment, like cleaner fuel standards and help for wildlife.
We must take action this day to keep and strengthen our commitments to those in need right now and in the future. We must take action this day to fight the homelessness crisis, to reverse social and economic disparities, to educate our children and serve those in foster care, to fund our transportation system, to protect our salmon and orca.
The governor says Washington has the money to pay for his priorities thanks to a strong economy and federal aid that have created a surplus. State Republicans say they want to see a tax cut in this legislative session, which is now underway.